to the channel Knowledge Star, Continuous Knowledge Excellence. My name is Anshika Gaur. This video is all about the points to deal with crashing patients, which will be explained by Dr. Deena Shah, Director of Emergency Services, Delhi NCR Fortis Hospitals Limited. So, without much ado, let's start the video.
Good morning. I'm Dr. Deena, and I'm very much thankful to CCNE and STM journals for inviting me here on this platform and giving me an opportunity to talk to the nurses from various hospitals. It's an honor to speak to the nurse as a doctor, because I believe that nurses are the backbone for the doctor. If your backbone goes, you fall. That's what I believe. And with that, I would like to take you through the little bit of clinical management of approaching the crashing patient in emergency, and then we will touch base on how to do the triage. So first of all, I would like to make it a little communicating. Anyone deals with a crashing patient ever as a nurse sitting here? Put your hand up. You have never seen any crashing patient as a nurse? Yeah, almost every one of you would have seen the patient who is crashing in front of you or about to crash, right? Yeah, so what do we do? How do we approach? And how do we save them? How to call the help on time? That's all we're going to do. This is the hospital I belong. It's a Fortis hospital. I work there as in Delhi NCR as a director of emergency medicine. Coming from an anesthetic background, living in Gujarat, going through various crises, including the riots, earthquake, and a lot more, I changed my profession from anesthetic to emergency medicine and thought of taking formal training, because when I decided there was no formal training happening in India. So I went to Australia, I did my emergency medicine for 5 years, and with the aim, because few of my colleagues were lost during the riots, and I thought this is the area which needs to be developed in our country. Not only for the doctors, it requires doctors, nurses and paramedics who runs and handles the pre-hospital care as well. So we are right now working on few wings of these. I thought of designing objective as follows. First, we'll try to understand the need for learning. Why do we learn these? That approach to crashing patient is needed. I don't think anyone has got a doubt for it. It's not only about the patient, it is about you and your family too. Because it's not always patient falls sick and then only you have to deal with them. It is about you fall sick or your family falls sick and you feel, oh my God, and they will look at you as a nurse working in some hospital that you know everything. And how do you approach them? How do you treat them? How do you carry them safely to the hospital? That all comes under that umbrella. So you need to understand that. And we should not have a doubt about why should we learn approach to crashing patient. The second, we'll design the priorities in assessment and management. And then lastly, I'll touch base on the concept of the triage. So this is what I thought when I was designing this talk, that sitting here and dealing with people and patient daily, you might be thinking that what do I deal with daily as a nurse? And one of these. So patient 65-year-old admitted in the ward and suddenly starts complaining of breathing difficulty. Do we deal with it? Yeah. Second, 45-year-old male post-percutaneous intervention in CCU, you're working and you see him on the monitor goes alarming, and you look at the monitor and you see something like this. Do we see this? Yeah? Good, I see some nodding heads. 38-year-old male transferred from ICU following sepsis care. He's off ventilator, off everything, and you receive him, and after 4 or 5 hours, he suddenly becomes altered mental status because of high-grade fever or what else is going on, we don't know. So you will be dealing it day in and day out, whichever area you work in, out of these, one of them patient, right? So we'll see what comes in your mind when you see them looking at this patient. First thing, I'm going to rush them to the ICU. Let me take them to the ICU. Let's go quickly to the ICU because ICU has got a team of experts and you were there alone. You can't handle them alone, so you want to rush them to the ICU, right? Second thought, shall I call a doctor? Some of you might be having RRT, rapid response team in your hospital. Some of you might have code blue in your hospital. And there is a restriction in code blue, arrest only you call. So what should I do? Shall I call a doctor or shall I rush them to the ICU or shall I call code blue or RRT? That's another question. And if you're waiting for the code blue or RRT or the doctor and he says, I'm coming, that coming time, even if it is 1 minute, it is going to be a hell of a time for all of us when we are alone with a sick patient and we don't know what to do. So let's take stepwise approach. Before you approach them, this comes first. Your hands should be clean. You should have universal precaution because if you are safe, then only that person can be safe. And you have to reach to another patient. If you fall sick, then all the other patient you can't attend and your expertise goes in the vein sitting at home or in another hospital treating yourself with the bad diseases, right? Step 3, as per various organizations, starting from American Heart Association to NHS to now in the new course has been designed by Indian government, which is called National Emergency Life Support. They advise this as a step 3 and talk to the patient and follow your ABCD. ABCD is the mantra of emergency medicine. And you have to assess, follow ABCD in your assessment, find out the critical problem, treat them, and then do follow your ABCDE. Now, ABCD belongs to airway with oxygenation, breathing with ventilation, circulation with shock management, disability assessment and neurological management, and then expose and examine them fully once you're done with them. So question comes, why we have to do ABCD and not DCBA, you know? Why ABC, ABC, ABC? Because everything in emergency and critical care is ABC. Because if we do not get oxygen, then what happens? Every organ from top to bottom dies. Be it a brain, be it a heart, be it a kidney, right? So oxygen and breathing is the utmost important. That's why it is sitting on the top. You need an airway pattern to take that oxygen in. That's why airway comes first. Then comes breathing. How you breathe adequately, ventilating, doing oxygenation, that makes you good up and above so you can deal with all the organ function nicely. The C is for the blood pressure and circulation. If your blood pressure falls, you feel faint. So you need blood pressure not only to keep going with your heart, but to keep going with your kidney and your liver, which are the metabolism organs. That's why we need C as well. The D. D gives order, like brain gives order to all the organs to function. And to keep it functioning, you need airway, oxygenation, and you need blood pressure, circulation. So it falls into that sequence. Airway first, breathing, circulation, and disability. That's why it is ABCD whenever you are approaching any crashing patient.
I hope you like this video. So guys, if you want to see these type of videos, then please do comment. We will definitely reach out to you. And subscribe to the channel Knowledge Star. Also, hit the bell icon to never ever miss an update. Thank you.
For more updates, subscribe to our channel, click the links shown on the screen to stay connected.